Everyone to the provincial debate on disability and inclusion. My name is Amanda Bittner. I work in political science at MUN. I wanted to, before we get started with introductions, first thank the network of disability organizations for putting this event together. The network of these organizations is a collaboration of 18 organizations that support persons with disabilities, and these include the Coalition of Persons with Disabilities for NL, the Autism Society of Newfoundland and Labrador, the Brain Injury Association of Newfoundland and Labrador, Canadian Hard of Hearing, Newfoundland and Labrador, Canadian Mental Health Association, Cerebral Palsy Association of Newfoundland and Labrador, Channel, which is Consumers Health Awareness Network NL, CNIB, Easter Seals Newfoundland and Labrador, Epilepsy Newfoundland and Labrador, Independent Living Resource Center, Learning Disabilities Association of Newfoundland and Labrador, NL Association of Community Living, NL Association of the Deaf, NL Down Syndrome Society, People First, Newfoundland and Labrador, Spinal Cord Injury, Newfoundland and Labrador, and the MS Society. We do have captioning and ASL interpretation happening this evening, and if anybody needs GO bus passes, please see Joby at the end. So, introducing the candidates in no particular order. I've got Earl McCurdy here, leader of the NDP party. Do a little wave. I think we all know who you three are, but you know, just to play it safe. Paul Lane, Liberal candidate, Mount Pearl South. And Clyde Jackman, current minister responsible for the status of persons with disabilities. So the way it's going to work tonight, first we're going to have a presentation from each of the three candidates. It's going to last 5 minutes. I've got a timer, so we're going to be very precise on time tonight. And then after they're done, we're going to open it up to questions from the floor. There is a mic. A couple of mics that are going to roam, so please just don't shout out questions from your seat. Please wait till a mic has arrived right in front of you so that we can all hear what you're saying. And then they're going to get a chance, each of our three speakers here, to respond to questions. I'm giving them a maximum of 2 minutes per answer per person. All three may want to respond, maybe just one wants to respond, that's all good. Either way, there's a timer on it, okay? Any questions, comments, concerns before we begin? Okay, so I'm also going to keep track of who's speaking or who gets to go first. It's very scientific. I've got their names on a list, and I'm going to cross them off as we go. So we're going to hope for as much fairness as possible here. You guys ready? Why don't we start with who's closest to me right now. So Clyde Jackman will begin, and we'll move that way for your 5 minutes each. And I think your mics should hopefully work right now.
Okay. Ready?
Yep.
Thank you. Thank you all very much for coming out this evening. I've been honored since October of last year to serve as Minister of Seniors, Wellness and Social Development, and Minister responsible for the Office of Persons with Disabilities. It's been an honor for me, but it's also been an education for me as well. Now, Premier Davis passes along his regrets that he couldn't be here tonight. He's in Labrador. And as some of you in the room may know, that I am officially retiring as of November the 30th. And I guess the obvious question is, why am I here instead of another minister? Well, I'll be quite honest with you that this role that I've taken on as being an advocate around the table for the disability community is one that I have taken with great pride. I have met with the advisory council, I think it's 4, maybe 5 times. I have attended events that have been held in this community. I've also supported and been, you know, as minister, I get to have some say in funds that get spent, and to be able to support these events about, first, promotion of what it is that we want to do, and secondly is to raise more awareness and attack the attitude that is, I think, still very prevalent in society as to how we address issues around disabilities. I will tell you that over the past month, 8, 9 months, I've had discussions with many groups. People who are in this room tonight have been present at those groups. I've had discussions with individuals. And there are certain things that the community has asked us to look at is certainly around accessibility. And I've had discussions with Minister Crummell, and I've had discussions with the Premier and our Cabinet. And the one thing that has come up on several occasions now is around the legislation. Around legislation. And when I look at the legislation, it says the Building Accessibility Act. I think that just tells me how outdated that is. Because from the disability community now, it's much more than about building accessibility. So I will tell you tonight, I've spoken to the Premier, and I've spoken to Minister Crummell, and we've had discussions on this, that if we are re-elected, we will complete a comprehensive review of the Building Accessibility Act, and I think change the name of it, along the lines of universal design. If there's one thing that I have acquired or learned over the last 9, 10, 11 months, is that there's much more entailed here than I had originally thought. So I will commit to you tonight that you will see this in our platform, that there will be a comprehensive review of that act along the lines of universal design. You know, my thought on it, quite simply for you, is that we've been looking at issues and how we need to address the disability community, and it's almost like it's something that we're doing as an afterthought. But really, we need to bring the community where it becomes not an afterthought, it just becomes a part of our regular planning. And the reason I'm here today is that I truly do believe in it, and when they were looking for someone to come to this to replace Premier Davis, I stepped up and said, I want to be there. I want to be there. I'm still going to have input into this. I still have input into what we're going to bring forward under our platform. So I wanted to be here tonight. So thank you very much.
All right.
Thank you. Next, Earl McCurdy.
Well, thank you, and good evening, ladies and gentlemen, and thanks for the invitation to participate in this event. I certainly congratulate the organizers for organizing it. It seems to me that our discussion tonight is fundamentally about human dignity, independence, self-determination, inclusion, and personal choice. COD-NL is a fabulous coalition that plays a key role on behalf of the various member organizations and the people they represent. Our society needs that kind of fearless advocate that will hold government's feet to the fire in pursuit of better programs for persons with disability, whatever stripe that government might be, including our own. A group of such importance needs adequate core funding, committed on a multi-year basis, so you don't have to wonder from one month to the next whether you'll still be in business. I ran for the NDP leadership because I believe in the values of the NDP, values that were so well described by the late Jack Layton, who constantly talked about a society in which no one is left behind, and by Tommy Douglas, who was voted a few years back as the greatest Canadian of all time for his role in creating Medicare. I'd like to just go back and repeat a few lines statements I made in last week's economics debate at Memorial University. And my reason for doing that is because I just want to make it clear that, issues that we're talking about tonight aren't just for a particular debate on issues of persons with disabilities, but are things to talk about in other forums as well, because they're such an important issue. I said, our history in dealing with the social and economic challenges is to treat the systems, not the root causes. The challenge is to dovetail financial management objectives with quality of life objectives. It's remarkable how often this can be done if you see the big picture. Beware of the siren song of privatization. There's no private sector solution for mental illness. There's no private sector solution for domestic violence. But there's huge social and economic costs if we don't challenge those challenges, if we don't tackle those challenges in a comprehensive way. We need a vision of society centered on fairness of opportunity and the lessening of inequality. So I repeat these because those are matters to be discussed whenever possible, no matter the audience, because they're at the core of NDP values, is what we believe in. There are a wide range of very specific issues that are integral to this debate. Accessibility, education, income and employment, housing, mobility, human rights, inclusiveness, to name a few. And the detail will undoubtedly come out in the question and answer period. There are altogether too many people in our province living in poverty, and I realize that for persons with disability, this problem is greatly magnified. Are there not enough challenges associated with living with disability that we have to add widespread poverty and woefully inadequate housing? Our platform for the upcoming provincial election has not been released yet, but we have developed a body of policy over the years relating to disabilities. We believe more needs to be done to make suitable employment available for persons with disability, and more needs to be done by government to ensure employers make necessary workplace accommodations to enable them to hire more people with disabilities. Government's own Opening Doors program needs to have the door open wider to provide something beyond entry-level employment and to require departments to use the program, not to just have it sitting there notionally. Housing is an enormous problem. We're convinced there are innovative approaches available that would improve the quality of life for citizens and be cost-effective for government. Our party has gone on record many times demanding more supports for inclusive education in our schools. Inclusion depends on those supports. The Buildings Accessibility Act needs to be revamped and then monitored periodically in sync with the Canada Standards Act. We need to be aware that poverty, lack of supports, isolation, lack of decent housing, a sense of lack of control are contributing factors to mental illness. We need to think upstream. Early intervention can head off problems that are debilitating to the individual and costly to government. Once again, we're talking about getting at the root causes. None of us should be lulled into thinking that awareness and dialogue are enough. Important as they are, they're only first steps, and real action needs to be the end result. There are many other issues I could raise, but I'm aware of the time considerations. In a nutshell, let's talk about what it takes to be more rigorous about assessing and removing the barriers to inclusion, decent housing, employment and education, about giving everyone a fighting chance to realize their dreams and aspirations and to contribute to society in a way that respects and enhances their dignity. Thank you.
Thank you. And now Pauline.
Good evening, ladies and gentlemen, and thank you to the network of disability organizations and COD-NL for organizing this event. I'm very impressed with this initiative you have taken to bring all three parties together for an open format on issues related to all 18 organizations and their members. Liberal leader Dwight Ball very much wanted to be here this evening. Dwight's district of Humber-Grossmorn is on the west coast and includes his hometown of Deer Lake, and unfortunately he had a previous commitment to the residents in his district, and he asked me to pass along his regrets. As the MHA responsible for Service Newfoundland and Labrador under the Liberal Opposition Office, I've raised several issues of importance publicly and on the floor of the legislature, including issues of supportive employment, access, inclusion, and workplace health and safety. In my role, I've also advocated on many issues, including awareness of workplace safety, blue zone parking, mandatory use of bike helmets, need for more accessible housing, supportive employment, access at public facilities, and benefits for injured workers. Many times my discussions have led me to sit down with Kelly White and members of COD-NL and other disability advocates. I'm glad to be welcomed by them this evening. While we have made progress in raising awareness and recognizing the challenges and achievements with disabilities in Newfoundland and Labrador, the reason we are all here tonight is because there is still so much that needs to be done. Just looking around and speaking with some of you earlier tonight, I can tell that the road is still a very bumpy one, and many of you are not satisfied with how the current Davis government has addressed your concerns. I'm encouraged that so many like-minded people have come together tonight to push for something better. As a united organisation, you certainly are a strong force, capable of anything. Author Margaret Mead said it best: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." I'm looking forward to hearing about the issues that have impacted you and giving you answers, and I hope will reassure you about the commitments of the Liberal Party. When I was asked to sit on the panel tonight, my first thought was admiration for not just the organisations represented here tonight, but also for the individuals. With the provincial election just 5 weeks away, too many people are not engaging in politics. Even here in our province, there's a sense of apathy as many people are just tired of political lobbying. This is why I admire, and I'm so impressed, that you have all come out tonight to listen to us politicians, to have your say on the issues and challenges you are facing every day. I cannot promise you will get every answer you're looking for in the next 2 hours, but it is just as important, no, actually it's more important, that I hear from you tonight. Being inclusive starts with not just listening, but consulting and responding to those concerns in a reasonable amount of time. I'm sure many of you have had your fill trying to get access to services in healthcare system only to feel defeated or let down. Healthcare must be accessible, inclusive, and based on outcomes. This is a priority for the Liberal Party. It's why Dwight Ball has already made 43 policy commitments since becoming leader in 2013. A dozen of these policies are directly related to healthcare, including an expanded scope of practice for healthcare professionals, a dementia program, replacing the Waterford Hospital with a new facility with construction to start in 2017, expanded primary health care teams all across our province, chronic disease management, and a mental health strategy. In fact, the Liberal Party has already publicly released more policy statements in advance of the provincial election than the other two parties. In the coming weeks, the Liberal Party will reveal our full election platform. We've been working hard on the ground, listening to every concern and every issue. Our platform will address those concerns and what you have been telling us. Just a few months ago in May, I had the opportunity to join my colleagues in hosting one of several Let's Connect public forums in my district of Mount Pearl South. Accessible services inclusion were topics that impacted many people who took part. With more than 75,000 people living with a disability in Newfoundland and Labrador, these are the topics that we need to place a clear priority on. I'm proud of the way my colleagues in the Liberal Party and I have advocated on behalf of those with mental illness and addictions, autism spectrum disorder, diabetes, dementia, access issues, and those facing barriers to employment. Our candidates, Lisa Dempster, Dale Kirby, Andrew Parsons, Kathy Bennett, and our leader Dwight Ball have raised these issues repeatedly in the House of Assembly. We have brought your voice to the floor of the legislature, and we will continue to advocate on your behalf after the provincial election, no matter the outcome. Thank you.